Alright guys, so this is our OTC Ophthalmology Tuition Classes episode number 4. So far we have done the anatomy of eye including the embryology. Now we are switching over to the orbit of eye. Now if we start with the orbit, so first and foremost is we need to know what are the walls of the orbit, what are the bones which are forming the four walls of the orbit. Right now, first just understand that if we talk about the orbit, so orbit is pyramidal in shape. It is not spherical, it is not square, rectangle, but it is pyramidal in shape, in which there is a placement of eyeball. Okay, now you can appreciate here that the medial wall of the orbit is facing forward, while the lateral wall of the orbit is not facing forward, it is facing outside. So there is some angle between the medial wall and the lateral wall such that it is forming 45 degrees because the orbits are divergent. What did I just say? That the orbits are not facing forward but they are divergent. But the interesting part is eyeball is facing forward. It actually tells me that there has to be some angle between the visual axis is that of the eye, and some angle between your orbital axis like this, and this angle is your half of 45 degree, that is approximately 22.5 degree. Clear hai ji? Okay, now there is medial wall, lateral wall, and also the superior wall and inferior wall. So there are four walls of the orbit. Okay, now the bones which are forming the medial wall of the orbit are the bones forming the superior, lateral and inferior wall of the orbit are. Before we proceed further, it is important that we should connect the dots by seeing the real video of the skull. So I am going to show you the video of the skull for better understanding. Now check this out. So first and foremost is you can see that there is blue colored bone, that is your frontal bone. Also you can see that there is orange colored bone which looks like which fly? Butterfly. Now butterfly has got three parts. One is the central body, and then there is greater wing, then there is lesser wing. So similarly this is your sphenoid bone which has got three parts: the central body and greater wing and lesser wing. So you can appreciate, I'm going to play the video, you can appreciate that the central part body has a pit. That pit is known as sella turcica, in which there lies pituitary gland. And you can also appreciate that on the sides of the pit there are two holes. This is your optic canal from which optic nerve passes into the orbit. Yes, and there are two protrusions, yes, that are clinoid process. Okay, now this is the frontal view. Okay, now if I ask you what are the bones that are forming the superior wall of the orbit, now if you can appreciate, so there is one blue colored bone, that is your frontal bone, and there is also some component of the orange bone. What is that bone? That is your, of course, sphenoid. But which part of sphenoid? The lesser wing of sphenoid. Okay, my next question to you will be, what are the bones which are forming the lateral wall of the orbit? Again you can appreciate there is some component of the orange colored bone, that is a sphenoid bone, but here it is not the lesser wing of sphenoid, it is actually greater wing of sphenoid. And along with that you can see that there is another bone which is your zygomatic bone. Yes, so there are two bones which are forming the lateral wall of the orbit, that is your greater wing of sphenoid and zygomatic bone. Okay, now the bones which are forming the floor of the orbit, easy way to remember is pa, ma, za. Palatine, which is not visible in this video, maxillary, which you can see in yellow color, then there is zygomatic, which is nothing but the extension of the lateral wall. This is a zygomatic bone. Pa, ma, za. Now the bones which are forming the medial wall of the orbit from anterior to posterior. You can see that there is yellow colored bone, which is nothing but we just did, it is maxillary bone. Then you can see that there is a cream colored bone, yes, and then there is white colored bone, then again there is orange colored bone. That orange colored bone is your body of sphenoid. So in other words, the medial wall is formed by the body of sphenoid, the lesser wing forms the roof of the orbit, the greater wing forms the lateral wall of the orbit, if I talk about sphenoid. And the cream color bone is your lacrimal bone. You would be able to identify one small depression on the cream colored bone, that is where nasolacrimal sac is lying. That is lacrimal crest. Don't confuse, don't say that sir, lacrimal bone, so this nasolacrimal sac. No, lacrimal crest has lacrimal gland. No, my dear friends, lacrimal gland lies on the superior temporal side of the orbit, and white colored bone is your ethmoid bone. Now again, let's quickly revise the medial wall of the orbit from anterior to posterior. We have got your maxilla, we have got your lacrimal bone, you have got your ethmoid bone, then lastly we have got the body of sphenoid. Okay, now can you see a small fissure which is looking like an opening between the middle cranial cavity and that of the orbit? Yes, that is your superior orbital fissure. And now can you carefully see and tell me superior orbital fissure is bounded by which structures? Easy, it is lesser wing of sphenoid and greater wing of sphenoid. So that is very important question. Okay, all right, now I think you are able to easily make out. So superior orbital fissure. Okay, okay, and there is one opening on the inferior side as well, that is your inferior orbital fissure. So there are basically three openings that connect the cranial cavity with that of orbit, that is your optic canal, superior orbital fissure, inferior orbital fissure. Now I think on the cream colored bone you can easily appreciate the lacrimal crest. I told you that in lacrimal crest there is nasolacrimal sac. Don't take it wrong, it is not lacrimal gland, it is nasolacrimal sac. Okay, all right, now I think it will be easy for you to remember. All right, so I told you about medial wall. Now the bones which are forming the medial wall, easy way to remember is USMLE. Some students, they prepare for United States medical license exam. U is silent, SMLE, but mind you, this is not in the order from anterior to posterior, posterior to anterior. Yes, okay. Inferior wall, pa, ma, za, palatine, zygomatic, maxillary, and lateral wall is greater wing of sphenoid and zygomatic bone. Okay, superior wall, lesser wing of sphenoid and frontal bone. Now if I may ask you, which is the strongest wall of the orbit? That is your lateral wall. Which is the thinnest wall of the orbit? That is your medial wall. So thinnest wall is your medial wall and strongest is your lateral wall. Now if I may ask you, which is the weakest point of the orbit? Don't think that okay, thinnest will be the weakest. No, my dear friends, what happens is, weakest point of orbit, we are talking in terms of any trauma which is happening. So of course the weakest point is going to give way, है ना? So whenever there is a trauma that hits the eye, so there is compression of the eyeball such that the superior part of the eye hits the superior wall of the orbit and inferior part hits the inferior wall of the orbit. Now in this quest, there is frontal lobe which is lying over to the superior wall of the orbit, while just underneath the inferior wall there is nothing, there is just air, there is just sinuses. So there is a easy disruption of inferior wall of the orbit. So weakest point of the orbit is inferior wall. Now if I may ask you that which is the most common wall which gets fractured in blunt trauma, it is your most common fractured wall of orbit in blunt trauma. That is going to be your inferior wall. I hope it is very well understood, है ना? Okay. And also I want to tell you, after doing the walls of the orbit, the shape of the orbit is, I had told you, just write with me, it is pyramidal, and pyramid has got one apex and one base. So this is your A, which is apex, this is your B, which is base of the pyramid. ठीक है जी, I hope it is clear. Okay, now what is the size or volume of the orbit? The volume of the orbit is 30 milliliter, but don't confuse volume of the orbit with that of volume of eyeball. Volume of eyeball is 6 milliliter, out of which nearly 4 milliliter is taken by vitreous humor. Shape of the orbit, I have already told you, it is pyramidal in shape. It is pyramidal in shape. And here what I have told you is, now I think it will be easy for you. So this is your zygomatic bone forming the lateral wall of the orbit. Yes. And this is your sphenoid. Which wing? Greater wing of sphenoid. This is the lesser wing of sphenoid. And this is the frontal bone. So this is forming superior wall of the orbit. This greater wing and zygomatic forms the lateral wall of the orbit. And inferior, you have got maxilla, you have got here palatine is visible. Okay, so maxilla, palatine, pa, ma, za. Then there will be zygomatic. So this is your zygomatic, Z, M, P. So this is forming the inferior wall. Then we have got ethmoid, sphenoid can be seen. So this is a part of sphenoid, and this is your lacrimal bone, and this is your maxillary bone. So I am just ethmoid, lacrimal, sphenoid and maxillary. I hope it is clear. We have seen the real skull video, so there shouldn't be any problem in understanding that. Okay, now I told you that there are three communications. One is your superior orbital fissure, second is your inferior orbital fissure, then we have got optic canal. Now if we talk about the optic canal is a small gap between the lesser wing of sphenoid. एंड शेक्सपियर बोल के गए थे, नाम में क्या रखा है? डॉक्टर मनीष बोलते हैं नाम में ही सब कुछ रखा है. सो व्हाट आर द स्ट्रक्चर्स विच आर पासिंग थ्रू द लेसर विंग ऑफ स्फेनॉइड? Means gap between lesser wing of sphenoid. As the name suggests, optic canal, so there has to be O for optic, O for optic nerve, and of course the same artery which is supplying the eye, ophthalmic artery. So there are two structures which are passing through the optic canal. Okay, all right. Now superior orbital fissure is a gap between lesser wing and greater wing of sphenoid. Now there is the central common tendinous ring. This central common tendinous ring divides the superior orbital fissure into three parts. I again repeat, ये जो central common tendinous ring है ना, it divides, it is very fibrous ring. What is its relevance? It gives origin to the rectus muscles. So there are 6 extraocular muscles, जिसमें से 4 rectus muscles होती हैं. So it divides superior orbital fissure into superior part, the middle part and the inferior part. Now this is your medial side, this is your lateral side. ठीक है जी. And this is superior rectus giving origin to superior rectus. This is giving origin to medial rectus, inferior rectus, lateral rectus. Okay, now as you can appreciate that there are 3 parts of the superior orbital fissure now. So what are the structures which are passing through the superior part of superior orbital fissure? First, how will you remember the name of the nerves? LFT. Normally whenever the patient gets ill and whenever the patient is having any gastric problem, we always go for LFT, that is your liver function test. So we are going to pick up this mnemonic to assist us in memorizing the nerves which are passing through the superior part of superior orbital fissure. And the nerves are L for lacrimal nerve, F for frontal nerve, T for trochlear nerve. Lacrimal nerve, frontal nerve, these are the branches of trigeminal nerve only. ठीक है जी, तो ये देखिए LFT lacrimal nerve, frontal nerve and trochlear nerve. Just write with me LFT. Okay, so trochlear nerve is your fourth cranial nerve, while lacrimal nerve, it is a nerve that supplies periorbital area. It supplies periorbital region. Frontal, as the name suggests, it supplies frontal region. Okay, all right. Now apart from these three nerves which are entering into the orbit via superior part of superior orbital fissure, there is one artery which goes out of the superior part of superior orbital fissure. There is one vein which also goes out. Now from optic canal there is ophthalmic artery and optic nerve which is entering. So inside the orbit, once the ophthalmic artery has entered into the orbit, it is going to give a branch which is a recurrent meningeal branch of ophthalmic artery. Now this recurrent meningeal branch of ophthalmic artery, although it is formed inside the orbit, but it will take exit from the orbit through the superior part of superior orbital fissure. So I am talking of this artery. As the name suggests, recurrent means reverse. Ophthalmic branch, of course, ophthalmic meningeal branch, of course, which is supplying the meninges of ophthalmic artery. And there is the vein which is passing through the superior part of superior orbital fissure, and that is your superior ophthalmic vein. So these are the structures that pass, out of which three structures they enter inside the orbit, while two structures they come outside of the orbit. Understood? Now let's write about LFT. We have told you recurrent meningeal artery, and also about the superior ophthalmic vein. Now there are 6 extraocular muscles. EOM means extraocular muscles, out of which 4 are rectus muscles and 2 are oblique muscles. These muscles move the eyeball. Now these 4 rectus muscles, they take origin from common tendinous ring, common CTR, common tendinous ring. And what is the nerve supply of these 6 muscles? SO4, LR6, rest 3, means superior oblique is supplied by 4th cranial nerve. The name of 4th cranial nerve is trochlear nerve. Lateral rectus is supplied by 6th cranial nerve. The name of 6th cranial nerve is abducens nerve. Rest, the remaining 4 extraocular muscles, are supplied by 3rd cranial nerve, which is your oculomotor nerve. ठीक है जी, oculomotor nerve. Now the name of 4 rectus muscles, SR means superior rectus, MR means medial rectus, IR means inferior rectus, LR means lateral rectus. 2 oblique muscles, SO means superior oblique, IO means inferior oblique. समझ में आ गया जी? Okay. Now lacrimal, frontal and trochlear. So trochlear we have done, lacrimal and frontal I have told you. These are the branches of lacrimal and frontal. These are the branches of ophthalmic division of trigeminal nerve. ठीक है जी? Okay. Now coming over to middle part of superior orbital fissure. Now the structures which are passing are nasociliary nerve, which is again the branch of ophthalmic division of trigeminal nerve. Then oculomotor nerve, the superior part and the inferior part. So you can call it as division only, superior division, inferior division. And lastly, abducent nerve. So let's write. So superior division and inferior division of oculomotor nerve. Then there is nasociliary nerve, which is ophthalmic division of trigeminal nerve. It is a branch of ophthalmic division of trigeminal nerve. Then we have got abducent nerve. Abducent nerve, which we have done, it supplies lateral rectus muscle. And from the inferior part of superior orbital fissure, there is exit of one vein, that is your inferior ophthalmic vein. Understood? Okay. Now please write with me, very important. Yes, what about blink reflex? Blink reflex first, and then we are going to do about the superior division and inferior division, which muscles do they supply. Blink reflex, any reflex in the body has got two parts. One is the afferent pathway, another is the efferent pathway. So afferent pathway is when you take a cotton wisp, touch it on the side of the cornea. So it is going to stimulate subepithelial nerve plexus, from which the impulse will go to long posterior ciliary nerve. Now long posterior ciliary nerve, the impulse will go to nasociliary nerve. Now from nasociliary nerve, the impulse will go to ophthalmic division of trigeminal nerve. Now from ophthalmic division of trigeminal nerve, so now this is afferent pathway which is completed. Now there will be efferent pathway. Efferent pathway will be via third cranial nerve, which is oculomotor nerve, and there will be constriction of sphincter pupillae. Sorry, there will be constriction of orbicularis oculi. Orbicularis oculi, and this is not third cranial nerve, so sorry for that. This is your seventh cranial nerve, which is your facial nerve. So afferent is formed by fifth cranial nerve, while efferent is formed by seventh cranial nerve. Have you understood this? Blink reflex. Okay, there is another reflex. Please write with me. So these are two reflexes. We are also doing a little bit of physiology. That is your pupillary light reflex. Pupillary light reflex. So there is afferent and efferent. So afferent of pupillary light reflex is when the light falls on the retina, it goes to optic nerve, which goes to optic chiasma, from optic chiasma, optic tract, from where it goes to pretectal nucleus of midbrain, and there are internuncial fibers. So there is one nucleus, pretectal nucleus, and there is Edinger-Westphal nucleus. Now the fibers which are connecting the pretectal nucleus to the Edinger-Westphal nucleus, these are internuncial fibers. So from pretectal nucleus there is Edinger-Westphal nucleus. So this pathway, optic nerve, is taking the impulse. So it is your optic nerve which forms the afferent pathway, and Edinger-Westphal nucleus is the nucleus of third cranial nerve, which is oculomotor nerve. It is third cranial nerve, which is ultimately going to pass through ciliary ganglion, ciliary ganglion, and it is going to supply sphincter pupillae. And so this oculomotor nerve is efferent pathway. So there are two reflexes that I have told you. One is your blink reflex when you touch a cotton wisp at the cornea. If you are eliciting blink reflex or anything which enters into the eye, there is blinking of the eye. That is blink reflex. And when you shine the light into the patient's eye, there is bilateral constriction of both the pupils. That is your pupillary light reflex. Okay. All right. Now, talking of the oculomotor nerve superior division. Oculomotor nerve superior division. Now, superior division pass through the superior side of the middle part of the superior orbital fissure. Don't get confused. So of course it is going to supply the structures which are present superiorly. What are the structures which are present superiorly? One is your superior rectus muscle, another is your levator palpebrae superioris. Now if I talk about my eyelid, so eyelid has got three muscles. Yes, which three muscles are there? So I am writing it in a box. So it is very, very basic. One is levator palpebrae superioris, another is Muller's muscle, and third is orbicularis oculi. Orbicularis oculi. So LPS, I am writing it detail. Levator palpebrae superioris. Levator palpebrae superioris. ठीक है जी. Okay. And if I talk about orbicularis oculi, we have just done. So orbicularis oculi, it is supplied by 7th cranial nerve, while LPS is supplied by 3rd cranial nerve, which is of course the superior division of oculomotor nerve, and Muller's muscle is supplied by sympathetic fibers. So oculomotor nerve superior division is supplying these two muscles, while the inferior division is going to supply the muscles which are inferiorly, which is inferior rectus, inferior oblique, and medial rectus. Understand? Able? Okay. So this is about the anatomy of a connection between the orbit and the cranial cavity. And I told you that there is inferior orbital fissure from which the structures which pass, you just need to, do a little bit of touch and go. That is your zygomatic nerve, emissary veins which are going out, and there are infraorbital vessels. Infraorbital vessels include your one artery and one vein. ठीक है जी, artery and vein. Okay. And the nerves, so you can see that there is infraorbital groove from which there is passage of infraorbital nerve. Okay. All right. So this is different, but we need to understand zygomatic nerve, emissary veins, and infraorbital vessels. Okay. So this is about the anatomy of the orbit along with superior orbital fissure and optic canal. So these are the two communications that we need to be well aware of.